When was the last time you went to see a healthcare provider? Not because something was wrong, but just to make sure everything is okay. This type of visit is a wellness visit. My name is April Greener. I'm a family nurse practitioner at Dent County Health Center, and I want to spend a few minutes today discussing specifically a Well Woman visit. The Well Woman visit is an important way to help you stay healthy. The goal of the Well Woman exam is to provide preventative care. A Well Woman visit includes a full checkup, separate from a visit for sickness or injuries. These visits focus on preventative care for women. It's much more than just providing care for your reproductive health. An important part of the Well Woman exam includes a few questions about your health, your family's health, and your sexual health. These questions are 100% confidential. They are only asked because it helps providers know what you need and how we can help you be as healthy as possible. In addition to the questions we may ask, I invite you to ask questions you might have. Nothing is off limits. We are here to answer your questions and help you however we can. In addition to a health history, depending on your age and needs, a Well Woman exam may include a physical exam, services like vaccines that improve your health by preventing disease and other health problems, screening tests, which are medical tests to check for diseases early when they may be easier to treat. Screening tests include screening for breast and cervical cancers by performing a physical exam and sometimes collecting a pap smear, which is a collection of cells from the cervix. Screening for sexually transmitted infections by collecting urine, blood, or a sample of fluid. Discussing your reproductive health and goals. Education and counseling to help you make informed health decisions. A wellness exam should be done every year. Depending on your age and needs, different services may be completed. You may have heard about a PAP or an HPV test. Let me explain the difference between the two before we discuss the guidelines. A PAP test and human papillomavirus both check for signs of cervical cancer. A PAP test checks for abnormal cervical cells in the cervix that could lead to cervical cancer, especially if left untreated. An HPV test checks for high-risk types of HPV that are more likely to cause precancers and cancers of the cervix. HPV is the most common sexually transmitted infection. Most people do not have symptoms of HPV and don't even know they have it. There is no approved test for HPV testing for men. This makes screening even more important for women. According to the American College of Obstetrics and Gynecology, women who are 21 to 29 should have a PAP test alone every 3 years. HPV testing alone can be considered for women who are 25 to 29, but PAP tests are preferred. Women who are 30 to 65 have 3 options for testing. They can have a PAP test and an HPV test every 5 years, they can have a PAP test alone every 3 years, or they can have an HPV testing alone for every 5 years. Clinical breast exams should be done every 1 to 3 years for women aged 25 to 39. Starting at age 40, women should receive a clinical breast exam yearly and start getting mammograms every 1 to 2 years. Breast exams and mammograms improve the chances of finding breast cancer early. The earlier breast cancer is found, the easier it is to treat. For cervical cancer, it usually takes 3 to 7 years for high-grade changes in cervical cells to become cancer. Cervical cancer screening can detect these changes before they become cancer. Women with low-grade changes can be tested more frequently to see if their cells go back to normal. Women with high-grade changes can get treatment to have the cells removed. Cervical cancer screening saves lives. Over the past 30 years in the United States, the number of cases of cervical cancer and deaths has decreased by 1/2. This is mainly the result of women getting regular cancer screening. And just like HPV infections, often early cervical cancer does not present with any symptoms. Screening is imperative in catching this early and initiating appropriate treatment. Ensuring that all people have access to quality and affordable healthcare is a priority at Dent County Health Center. We have multiple programs available to ensure that all women have access to women's healthcare. The Show Me Healthy Woman program provides Well Woman services for women aged 35 years and older. Eligibility is determined by 3 categories: age, insurance status, and income. Your eligibility can be predetermined over the phone prior to your appointment. Dent County Health Center is a Title X family planning clinic, something I am really proud of. With Title X, we can provide family planning services, well women services, testing and treatment for sexually transmitted infections for men and women for significantly reduced costs or for free. There are no age restrictions and clinic visits are always confidential. We also have a state-funded program that assists in testing and treatment for sexually transmitted infections for men and women with no cost. The mission of the Dent County Health Center is to promote and protect the health of all citizens of Dent County. Your health is our top priority. Please visit our website at dentcountyhealthcenter.org to schedule an appointment, or you can call us at 573-729-3106. We look forward to seeing you, helping you, answering your questions. We are here for you.